Assalamualaikum and good morning everyone. Welcome to MSQH ECRI webinar series. Thank you for joining us today on this session with the topic of Pandemic Spread Watch, Break the Chain of Infection. This is our very first series of public forum webinar to share knowledge about the ongoing COVID-19 pandemic in Malaysia and what are the ways in minimizing risk of infection and what should you do if your place had patrons or colleagues that had contracted COVID-19. Are you testing, cleaning or disinfecting? MSQH and ECRI experts in healthcare sector team up to share some insights and strategies used in healthcare setup that can be informative and adopting best practices in operating your businesses during this pandemic. The infection control expert is sharing with you some of the infection prevention and control practice in hospital and healthcare facilities that can be adapted for your local business setup and to look up for the priorities in order to have a successful plan during this pandemic. Before that, let me introduce Malaysian Society for Quality in Health. The Malaysian Society for Quality in Health as a national accreditation body was established in 1997 with the mission of advocating, educating and monitoring continuous quality improvements and safety in Malaysian healthcare arena. MSQH is recognized nationally and internationally as the leading Malaysian organization which promotes and improves safety and quality in the provision of healthcare services in Malaysia. Through active and smart partnerships with healthcare professionals, relevant facilities and agencies, and educational institutions involved in healthcare, MSQH has become the national voice in continuous quality improvement in healthcare facilities and services. In order to realize this mission, MSQH develops standards, plans and implements accreditation programs, promotes safety and quality improvement in healthcare facilities, and organizes opportunities for communication of ideas and exchange of experiences on current and best practices in healthcare. So, for today, I would like to invite Professor Datuk Dr. Haji Abdul Rahim Abdullah, a public health physician consultant in health management and currently serving as Chief Executive Officer in the Malaysian Society for Quality in Health MSQH to start this session.
Good day everyone. I would like to welcome everybody to the first session of the MSQH ECRI webinar series. For the last 20 years, MSQH has been very active in the Healthcare Facilities and Services Accreditation Program. And that includes the hospitals, clinics and the hemodialysis centers at the moment. The last 20 years we have seen 187 hospitals have gone through the process of accreditation, and some of them have lapsed. Currently, we have 122 hospitals that have still have their accreditation status. This is part of MSQH strategic goal of promoting best practices in healthcare industry. MSQH advocate and facilitate continuous quality improvement and safety in the provision of health services and its delivery, including standards development, education, training, and performance assessment. The other strategic goal is the dissemination of information in relation to quality and safety in healthcare, including the general public, especially to the prospective clients or patients of healthcare facilities in the hospitals, in clinics and the hemodialysis centers. With this information, we hope that the people in the healthcare industry, as well as the clients and patients, will be able to make informed choices. The appropriate decisions or informed choices must be made taking into considerations of up-to-date information and knowledge of the situation. Today and in the subsequent session in the MSQH ECRI webinar series, we aim to do just that. In particular, we would like to focus on our current situation and challenges, in particular with regard to control of infection. We have Mr. Eric Wu, who's going to speak on the practice of infection, control and prevention, anywhere and everywhere. Thank you very much. I hope all of you will enjoy today's session and the subsequent session in this series. I hope the year 2021 will bring better tidings, and all of us will be able to rebound higher to meet the challenges that the year 2021 will bring. Happy New Year.
Thank you very much, Datuk Rahim, for the introduction of the topic. In response to the several COVID-19 infections in workplace around the country, we host this infection control webinar series to tackle issues and concerns during this difficult time. So now, it is my great pleasure to invite our next speaker, Mr. Eric Wu, Regional Director, ECRI Asia Pacific. He is responsible for ECRI Asia Pacific Development and Operations. ECRI is an independent, non-profit organization improving the safety, quality, and cost-effectiveness of care across all healthcare settings internationally, with a focus on patient safety, evidence-based medicine, and technology decision support. ECRI is respected and trusted by healthcare leaders and agencies worldwide. Over the past 50 years, ECRI has built its reputation on integrity and discipline rigor, with an unwavering commitment to independence and strict conflict of interest rules. ECRI is the only organization worldwide to conduct independent medical device evaluations with labs located in North America and Asia Pacific. ECRI is designated as an evidence-based practice center by the U.S. Agency for Healthcare Research and Quality and a federally certified patient safety organization by the U.S. Department of Health and Human Services. In 2020, the Institute for Safe Medication Practices, ISMP, formally became an ECRI affiliate.
Hi, welcome to MSQH webinar series on infection control and prevention. My name is Eric Wu from ECRI. My topic on infection control today relates to whether we're doing the right thing and doing the things correctly, particularly related to infection control. Let's begin by looking at some of the research findings and statistics that has been published internationally. So 80% of infectious disease are transmitted through our hands. And our hands has been in contact with more than 300 surfaces every 30 minutes. So the statistics shows that we are potentially exposed to 840,000 germs within the 30 minutes time frame. This is a lot of opportunity for us to be contracting any infectious disease by just sheer touching a surface itself. It can be a surface of our own face, it can be a surface of the doorknob, any surfaces that we can come across with in our day-to-day activity. Since we now know that we touch a lot of surfaces, let's take a look at where we commonly get engaged with the various surfaces during our day-to-day engaging activities itself. Some reports publish and mention that our workstation, like my office table, a clinic office table, it has 400 times more bacteria compared to an average toilet seat. This is really an alarming information. I never thought that my office table can be any dirtier than the toilet seat, but this proved me wrong, right? So the other areas I want to talk about is our home. We spend a lot of time, and our family spend a lot of time at home. And we never thought that the place where we prepare food for ourselves, which is the kitchen, harbors the largest amount of bacteria that can be transmitted to us and our family itself. So do take note that our kitchen is very dirty. We have to really do a lot of the cleaning and disinfection in that area itself periodically. Other than actually the area where we work and area where we spend a lot of time with our family at home, people go to gyms, areas like restaurants that we actually visited. We go to malls for shopping. Even in the hospitals that we visit as a patient or as a visitor as well, those are areas where we can be touching many variations of surfaces that may result to contaminating ourselves with certain bacteria and viruses as well. In these next couple of slides, I am actually going to share a little bit more about the care that has been taken by various stakeholders to ensure that bacteria, viruses are being managed within those facilities itself. And in this case, I've chosen a health facility, and let's look at the areas where germs are living and the surfaces that are involved in this health facility, and basically some of the standard precautions that commonly are taken by the health facility people. So if you look at it, we can look at the surfaces on the tables, the clinics of the doctors, the surface on the couches where patient lies on, the chairs that you sit in the clinic itself, the human skin that carries around bacteria from another place to another place that you have to be concerned about, and the instruments, equipments that are being used within that clinical facility is where we have to take more precaution in terms of infection control. Some of the standard precautions that are commonly being taken today by all the healthcare facility, cleaning, those are common things that they have to do daily. Disinfection of surfaces, that's important to be done. Making sure that instruments have been sterilized every time it has been used. Making sure that there is a routine, robust schedule to ensure disinfection and cleaning are being done in their health facility itself. So these are some of the precautions that they do in areas where they find surface where germs can be harbored. So other than the facility surface that we talked about, we also need to take a look at the people that is being engaged or coming into those facilities, whether it's a hospital. In this case, the example is on a hospital, but it can be your mall, it can be your gym, it can be your restaurant, it can also be your office itself. But in this case, in the healthcare facility, patients, healthcare workers, and family members can actually or potentially bring in those germs, bacteria, and viruses into the healthcare facility itself. So there are standard precautions that needs to be taken and processes that need to be applied, particularly on a healthcare facility, and you can see them on the right column with all the information. So other key statistics that we also found, particularly today when COVID-19 is such a prevalent disease, many has been talking about indoor air quality. Statistics shows that we actually spend 90% of our time indoor, and a lot of us do our work indoor, our activities, our engagement. Even when we are at home, if we turn on the air condition during a hot weather, most of the airs within our home are actually confined to that square box that we are in. Ironically, the statistics found, or alarmingly, the statistics found that the indoor air that is confined are actually 5 times more polluted than the outdoor. This dramatically increased the challenge to actually manage those kind of facility in terms of the airflow itself. So if an infected person is within that confined area, chances of spreading that virus or the disease can be quite real. So this particular slide reinforces what we have discussed earlier on the mode of transmission. And then coming back to the healthcare facility, these are some examples of standard precautions that we adopt to help minimize the risk of infection within the healthcare facility itself. I wanted to point out as well that although the health facility has a good standard precaution, we do not see the same in other facilities that we engage our daily life with. For example, restaurants, gym, malls, offices, etc. And I would really like to see that there is an opportunity for those facilities to enhance not just their cleaning activities that they do, but also enhance certain kind of standard precaution to help everybody in minimizing the risk of infectious disease. So of course, we don't discuss this main pandemic issue that we are facing together as well today. ECRI has published many articles related to COVID-19, particularly on risk management and also infectious disease management as well. So I'm just going to zoom into one of the slide deck information that we have, focusing on disinfection recommendations. We know very well we have to disinfect. We know very well we have to clean not just our hands, our body, but also everywhere else that has a surface that we are concerned about. So with COVID-19, it's no difference. It is going to be even harder, and we have to be more compliant to it because of the infectious level of this particular disease itself. So one of the key recommendations, particularly in the healthcare facility itself, we have to make sure that communications with patients, the residents of the facility, and the staffs are clear. We all have the same objective to ensure that disinfection or cleaning can be done so that this risk of infectious disease can be minimized, particularly in our healthcare facility itself. Mostly on the healthcare facilities, we also identify and we will prepare key rooms that are for aerosol generating procedure. So anything that we have to do in terms of treatments and care for a patient in the healthcare facility, we would make sure that we will have a special room if the particular procedure generates aerosol. So that's very important. We need to make sure that disinfectant related or effective for SARS-CoV-2 or COVID-19 are being used. So the selection is important. Staffs are required to be given additional or refresher training in terms of disinfection activities that has to be performed. Because we're so busy with the number of type of patients and the facility can be a war zone, the use of checklists to remind staffs, residents, and even patients themselves as to how we should prevent ourselves from getting infected is very important. So a checklist related to how we should be cleaning, when we should be cleaning, what everybody should be doing is very important in this context. Making sure other than cleaning the surface with disinfectant and all that, if possible, use additional technology to help clean up the facility and the areas that we are talking about. So this is my last slide, and before I go into my last slide in a little bit more detail, just want to recap what we just talked about for the last 10 minutes. Hand hygiene, very important. It is really a critical area. There are many surfaces that we could have contracted a disease or an infectious disease in that matter. We have to look at some standard precautions that health community or healthcare facility is adopting, and potentially those some of those activities can be adopted in other areas to help minimize such a risk as well. COVID-19, there are different practices that needs to be applied as well in terms of infection control. That is currently being practiced in many healthcare facilities, but we're not sure if this is being adopted everywhere else as well, where we can be engaged in our day-to-day activity. So that's really what we are sharing for today. And coming back to our last slide here, ECRI has done a lot of research in terms of technologies related to infection control. In our next webinar that we will talk about, we're going to dive into a little bit more about the various range of technology itself, like the tunnel of disinfection, UV lights, all the different disinfectants, what about the mist disinfection and all that. So we'll give you a little bit more clear picture in the second webinar that we're going to talk about. With that, I end my presentation. Thank you very much.
Thank you, Mr. Erico, for the great presentation, and thank you everyone for attending today's webinar, Pandemic Spread Wash, Break the Chain of Infection, the first series of MSQH ECRI webinar. I hope you have enjoyed the session, and don't forget to send your feedback to us through the link given at the comment section. And please help us to like and share this video so that many more could benefit from this public forum. We also would like to invite you to register yourself for the second series of Prevention, Control and Infection webinar, Adopt, Adapt and Apply, Infection Prevention and Control Best Practices by MSQH ECRI with depth understanding and practical guidance for the benefit of your organization and workplace. It is suitable for any company or individual seeking to enhance their understanding of infection prevention and control. This next session is expected to last 1.5 hours, which includes a Q&A session. As we draw towards the end of the year, MSQH and ECRI would like to acknowledge the hard work of the many people in every sector during 2020 in coping with the pandemic COVID-19. We also take this opportunity to honor the men and women who risk their life to care for COVID-19 patients, who work endless hours and face physical and mental exhaustion, and lastly, to those who lost their life in service. On behalf of MSQH, ECRI and our presenters, thank you for joining us today. We leave you with the teaser of the next webinar series of MSQH ECRI held end of January 2021. See you in our next webinar series. Happy New Year, everyone.